Hello, my name is Jessica. I'm representing the 2019-2020 ABSN cohort to present our community health project to benefit Sister Rose House. Here we have a quick assessment of the community, and there are a few things we want to highlight. New Bedford is very ethnically diverse. 21.1% of people live below the poverty line. That's about double the state rate in Massachusetts. Only 17% of people 25 and older have attained a bachelor's degree or higher. According to the January 2019 point-in-time count, there were 433 homeless individuals. Most are in emergency shelters, some are in transitional housing, but still a significant number go unsheltered, 49 as of the 2018 point-in-time count. Mental illness is a big issue among the homeless population, and other subpopulations of the homeless exist, such as veterans, victims of domestic violence, and those suffering from HIV and AIDS. The people we served at Sister Rose this semester mirrored this bigger picture. Of course, in this population, the majority were living well below the poverty line, so this demographic was overrepresented. But this makes sense when we consider that we were in a homeless shelter and soup kitchen setting. The population was racially and ethnically diverse in their educational attainment, and they struggled with issues such as mental illness and domestic violence. Several were veterans. Here is a list of the health concerns we identified at Sister Rose Shelter. The ones we saw most were the chronic diseases, metabolic disorders, mental illnesses, and foot problems, since we were providing a vital signs and foot care clinic while we were there. Healthy People 2030 is currently in development, but it tackles a lot of these issues and touches the homeless population in so many ways. Its foundational principle is to eliminate health disparities, achieve health equity, and increase health literacy. This project was designed for the residents of Sister Rose Homeless Shelter as well as patrons of the soup kitchen there. We prioritized designing a project at the intersection of these two groups that would engage the residents while benefiting the soup kitchen, and also that would be something that would strengthen Sister Rose's operation well after our departure. Due to the current COVID-19 pandemic, our clinical time at Sister Rose was cut short, so we had to consider how we could be of help without actually being there for implementation. We wanted to design a project that would bridge social, physical, cultural, and linguistic differences in the community because we really see a diverse cross-section at the shelter. Finally, perhaps most importantly, we wanted to design something that was not driven by us, but driven by the shelter. And this is how we really settled on the garden. It was an area prioritized by shelter staff and an intervention that already had a lot of momentum that we could lend resources to. This intervention is backed up by strong evidence. We know that the diet of homeless individuals lacks essential nutrients due to the cost-prohibitive nature of fresh fruits and vegetables. And we also know that many people, not just homeless individuals, lack knowledge of where their food comes from and have never grown a fruit or vegetable themselves before. So this is really a rich intervention full of potential for engagement, education, and improved health outcomes. So we designed a GoFundMe page with the goal of raising $1,000 to support the Sister Rose Community Garden. As of April 16th, we're halfway there, and we're confident that we are going to be able to meet our goal by the time the campaign ends. We are giving the money directly to the shelter director to purchase items vital to the long-term success of the garden. These include tools like shovels to engage more volunteers, supplies like gloves and storage bins, and infrastructure improvements such as fencing. Another important part of our intervention is education. Obviously, we're not able to provide the education ourselves because of the pandemic, but we spent a lot of time discussing how we would go about doing so. Topics we would want to focus on are nutrition, the benefits of gardening and gardening techniques, and where our food comes from and how to grow it. Methodology is really important because most of our target population is not going to be reading written materials and learning that way. The best education we were able to provide in our short time there was through conversation and sharing, usually during the soup kitchen. For the garden, demonstration and hands-on experience is going to be our best bet. And finally, we can teach people, but if they don't have the opportunity to put what they learn into action, our intervention has very limited effect. To improve engagement with the garden, we brainstormed with the coordinators of the garden to provide open gardening hours when residents can freely spend time in the garden. And we also talked about providing chairs and signage to encourage people to mingle in the garden, since a really powerful part of gardening is simply just being outside and among the garden. One way we will evaluate our outcomes is by tracking how many residents engaged with the garden and for how long. We'll also use the teach back method, where we teach the residents something and then determine if they are able to teach it back to us effectively. Research studies have shown positive effects of this method in the healthcare field on patient satisfaction and perceptions, self-management and knowledge, and quality of life. Our expected outcomes are that the population will be able to manage the garden and demonstrate a greater understanding of nutrition and the benefits of gardening. We also expect that the community will engage with the garden more and that the soup kitchen will directly benefit from the food grown. As expected with any intervention, there are potential barriers. There could be low enthusiasm or motivation to participate and a lack of implementation after we leave. There's a quick resident turnover in the shelter, so building institutional knowledge will be challenging, and there may need to be continuous re-education of new populations. As stated previously, we were not able to carry out the educational aspects of this project, so our big move in the future would be spending lots of time educating residents and soup kitchen patrons. To overcome the most likely barrier, low enthusiasm or motivation, we talked about providing teachings during soup kitchen meals, as well as potentially providing small incentives for participation, which could come in the form of like a garden pizza party where people come volunteer for an hour and then enjoy pizza in the garden. Another barrier that was presented by the shelter staff is stealing. It's been an issue in the past. We would want to make more visible to passersby how the garden is positively impacting their community. We'd want to teach about not picking unripened produce and even maybe make some available for the public. For example, the previous cohort did a seedling giveaway to accomplish this. And then to continue the work, community health nurses should incorporate preparing and utilizing fresh produce in their education. This is the kind of work that can be expanded to more areas, especially in the greater New Bedford area. So talking with city officials about increasing community gardening activity would be a promising step. Citing reputable articles such as those on this slide about the benefits of gardening would be particularly important in recruiting these new partnerships. To end, we would just like to reiterate the amazing benefits of gardening. Being outside and gardening provides stress relief, boosts immunity, provides for greater physical activity, delivers much needed vitamin D, and can even reduce the chance of dementia. So it truly is an amazing activity to incorporate into the way we design and deliver health interventions. And it's also something that we would encourage everyone to incorporate into your personal lives. Thanks so much for listening.